Thank you, Dr. Madhul Sahani, and thank you all. And today is the 1723rd day of International Session of IFPH. Before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1723rd day of uninterrupted daily webinar of IFPH. And today our speaker is Dr. NIMAI CHANDRA DHOLE, Principal and Head of the Department of Practice of Medicine, JEMS Homeopathic Medical College and Hospital, Hyderabad. Dr. Dhole got the learning opportunity from legendary stalwarts in India like Dr. S.K. Dubey, Dr. Mahindra Singh, Dr. Banerjee. He is a versatile personality, presented several scientific papers in national level conferences and published articles in different national journals. He is a resource person of various organizations like Ayush, NRHM, ROTP programs, and he is the examiner and paper setter in various universities of MG University, Kerala University, Vinayaka Mission University, likewise. And today, the topic of discussion is role of homeopathy in skin diseases. Let's welcome Dr. Dhole, and I welcome you all for the session.
Dr. Bindu Raj, yesterday Dr. Dhole has presented this lecture in Hindi also. It is nice that he has agreed to speak it for the English session also.
Okay, that's great.
Yeah. So thanks to Dr. Dhole for joining again for the skin disease. You can start your session now, Dr. Dhole.
Doctor, you can unmute yourself. Yeah.
Good evening, you have to make him the co-host.
Yeah.
Namaskar. Good evening to all. Are you able to hear me?
Yeah. We can hear you.
Thank you so much for inviting me for this session. And today, as it is introduced, that we are going to discuss about the common skin disorders. I'll just talk first. There are some common conditions which usually we come across in our daily practices. As skin disorder, actually, it differs from area to areas. Not all disease condition may be prevailing in particular areas, but there are some common conditions which in our country usually we come across. I'll just talk about all those things beginning. Then I'll just go ahead with some cases what I have treated recently. So I may just now start my presentation, sharing the screen. Is it my screen visible? Is it visible screen? Hello. Yeah. So objective actually to understand the common and uncommon skin diseases seen in daily practice and to discuss the homeopathic management of skin diseases. First of all, I just give a small anatomy of the skin, just if you can see that skin being the largest organ in our body and which is the outermost, or you can say this organ is being exposed to a lot of injurious agent daily. What we come across. So wherever we go, we are putting many protective mechanisms, but still we need to have some part of the skin should be exposed to.
We need to start the slides. It's not visible now.
So already I have started. I don't know. Is it visible now?
No.
Oh.
Yeah, it's now okay.
Okay. Thank you, sir.
And we can make it full screen if it's possible.
Yes.
Yeah, thank you, sir. It's visible. Let's start.
Okay. So this is the what you call as the skin structure. If I want to say that, being, as I said, being that is the largest organ in our body, and it is the most maybe neglected organ, or else in some point of view. And some point of view, we say that it is very much taken care, well care taken organ, because at certain age, actually, especially women, they may be having okay cosmetic matter for that, they may just go for the very special care. But what happens these days is there may be sometimes some over care we take also. That also matter. One is under care and there is over care. So over care means sometimes what happens, we use many cosmetics that itself is dangerous for the skin. If I can say that ancient days, there is no soap usage. People say that using soap itself is not good for skin. So all those things, if we keep in mind, we will be getting a different kind of myths and what you call as that facts. So I can say that there are some people in West Bengal, when I was in Kolkata, they used to tell that, okay, you should use sometime only that mitti, only that soil itself can be rub your skin, or just wash your skin without any no chemical soap or whatever it is. So if you see that way, so maybe we injure our skin by our own, either being overprotective or maybe not giving any care like that. So whatever it is, maybe the cause, that disease can happen. A lot of external influences are there, and there are few more internal influences. I just show the slides. So as per the structure, what you know, but it may not be important for us for practicing, but as a student, those who are there, they may be requiring this to learn regarding the dermis, epidermis, and sebaceous glands. When there is some difficulties like a blockage, what the disease can happen for that. So I'll just go to the next slide. Okay. Which is already I told. What are the functions of the skin it does? Actually, the heat regulation, body temperature regulation is the most important job the skin is doing daily 24/7. Along with that, it has stores of water and the fat, and the sensory organ it acts. We get the sensation, also sensation with the skin itself, and it prevents the water loss as well as prevent impure bacteria use. So there are many varieties of activities of the skin it does, and with that I just go with this. What are the different kind of skin disorders? Broadly, skin disease actually faces this infective condition like bacterial, fungal, virus, parasitic. Non-infectious means allergic, autoimmune, and idiopathic causes. And some chronic condition like eczema, psoriasis, acne, vitiligo, melasma, and skin cancer, of course, it comes in this. So this is the different varieties of skin condition. Now, as I was talking about this external and internal, what do you call as agent, how we get the skin disease. External influences, if I see, there are like climate. Of course, you know, there are some condition in the winter season we get, some we get in the rainy season, some maybe getting like moisture is more, we get tinea cruris, tinea of other affection, and some sensitizers, whatever we use in our body, sometimes some cosmetics, that also could be a external factor, as I said you. For the cosmetic beauties, many young people, they'll be using a lot of the creams and some other moisturizer that itself can cause sometimes some hazardous condition. Infection, of course, as I told you, outside infective agent that can cause sometimes skin some infections. Trauma, of course, is, as I said, the outermost organ. Trauma, now and then we can just get trauma. For that also, there could be some condition can develop, and some irritants. Of course, like we are working the garden, or we are cooking, we are like handling some, or you are in the job occupation. So anything like some irritants, if you are to handle, that can cause contact irritant dermatitis. Whereas other exogenous internal factors like food, then that endocrine condition like diet, then endocrine, some condition also can cause, then drugs. Some lot of allopathic drugs can cause some skin disease as a side effect, of course. Immunological condition also very much have role that to develop some condition like a hypersensitive skin reaction. You can see vascular disorder like varicose vein. Mind, yes, that is one of the important thing what we get actually. When I was actually in my maybe school level, I used to listen actually radio talk, health talk. In that, one of my actually one of the doctor, dermatologist, he was just speaking about skin disease. I was hearing that, and I could understand some ideas about urticaria. Urticaria, how it happened, urticaria. He was saying that he had a patient where the daughter-in-law doesn't jail with the mother-in-law, so they cannot just cope up with each other. And this daughter-in-law, whenever sees the mother-in-law, she get itching, skin itching. I was not having any idea. I was in maybe 8th standard, if I can remember it. So then I just realized that how is it possible? By seeing somebody, I'm getting skin itching. Is it possible? I came to know when I joined homeopathy and when I just come across many drugs, it is really true. So the allopathy doctor, he has given the glimpse that how skin disease can happen, especially urticaria can happen with the psychogenic. So psychogenic urticaria, psychological influence in the mind. So mind is one the, as you know, psychogenic conditions are now boon, or that is the major part of the today's any disease condition that psychology will blame, and it is true. Metabolic or nutritional condition, you know that because there are some children, you see that they are having low metabolic what do you call it, so nutritional deficiencies are there, and for that we get different disease condition. One thing I can tell, vitamin A deficiency. Okay, vitamin A deficiency that can cause pyrenoderma, some kind of skin disorders, and there are a lot of vitamin deficiencies as well as the minerals and food. If they're getting less, we get a lot of skin condition. Then focal sepsis, of course, it is like sometime it can happen when it goes, some sepsis happen in our body. That also can come up with like what do you call it, that parasitic infestation, like what do you call it, worm infestation. That also can cause sometime skin disorders, itching of the skin. Okay, filariasis. Okay, that also can cause skin disorders sometime. A lot of itching that happens because of allergens there. Similarly, some focal sepsis also can come up with some skin disorders. I have some cases I'll show you. So this is actually if I see in one slides, I just want to show you that this is actually how we develop the skin disease. If you can remember this, then it's fine. So diathesis, if you see the seborrheic, eczematous, then psoriasiform, then allergic, emotional, neoplastic. Neoplastic means cancer condition. So these are all diathesis, means tendency to develop some disease condition. And the disease, if you see that how is happened, that eczematous, then psoriasis, then lichen condition, lichen planus, then arterial, then pyodermis, the neoplasm, and atrophies, skin atrophies. This is actually the diathesis in the skin, like how are the reaction pattern, how it happened in the skin. This is the theme of the origin of the skin disease. Now, I'll just show another slide where the major part of the skin, actually the disease condition happens. The red part, actually almost the half portion, is the infection. The pyoderma, scabies, mycosis, warts, herpes, leprosy, leishmaniasis, or syphilis. Textbook, if you see, you get ample of things. And with the climate, mostly the malaria. We know that now it is going on the summer. We know the ghamodi in Hindi we call as. So this skin disease like prickly heat. Okay. Intertrigo, chilblains, all those things. But the summer cold, summer having that summer season, it can usually seen. The allergy, which is the eczema, then drug eruption, urticaria, of course, it is very commonly seen. Miscellaneous condition, a lot of things are there in these. Major part also, one of the major part, there is the acne, alopecia, vitiligo, chloasma, psoriasis, nevi, pemphigus. A lot of condition comes actually under this neurodermatitis, dermatitis, lupus, lichen, then internal diseases like erythroderma, then vitamin some condition, but related condition also. So now next is, sorry. Yeah, this is a common disease condition, already name it, the vitiligo warts in joining here. Warts is the virus condition, the viral warts. So tinea, molluscum contagiosum, and psoriasis arterial lichen planus alopecia. Here now start with the scabies. Very much itchy condition usually seen in the school in children where there is a very crowding hostel staying children. We can see them. The parent come with the skin condition. The child is having in the finger waves full of small skin eruption and very much itchy. they can't sleep at night, and it may eventually spread all over the body also if it is not treated well. And we have very, very good medicine in our homeopathy. And I'll just talk about this scabies actually, if I'm not wrong, it is Dr. Barnett. Dr. Barnett, he has told that how we can treat scabies. He has told there in his one writing, if I remember during my MD, I've studied that. He said the sulfur bath. Sulfur bath can be given for scabies because scabies is external. And if you can each mine, if you can kill it from outside itself, it doesn't go inside. That's what I learned from Barnett, his one literature I've studied that. And that is here actually external application where it is been told by the stolovers. You can remember this, sulfur bath can help, sulfur ointment sometimes can help for the scabies. We have some other drug, of course, I'll just discuss later. This is each mite and how it is happening. I have to rush through because a lot of slides are there. Vitiligo, you know, it's white things. You can see this. I'm not going much. It's a melanin synthesis problem that you can remember this. Keloids and scar formation. Okay, we have a lot of drugs are there for keloid. You know that, like fluoric acid to the then thiocyanamide, some drugs are there. Okay, then one to check the same earlobes. Yeah. Tinea capitis, tinea is ringworm. It is ancient time. It is happening tinea. You know that a lot of example we see in animal literature, especially in the organon textbook. We see that. It's tinea capitis, and it's tinea corporis, and tinea cruis in the groin region. There are a lot of the nail, some changes are there, some other condition like paranoia. I just rush through this. What is the common condition we see? The hives or urticaria, you know, it is a hypersensitive reaction. Of course, it is individual may get. Some individual, they eat some particular food item, they can digest, but some cannot. Okay, it is like sometimes some protein is more, so muscle stimulation for that, this thing happen. And some may be having allergy to the mosquito bite. Some may be having some particular, like some dal, some will be having some vegetables. Allergy, some food, veg and non-veg food can happen. Allergy. 1 in 6 person may be having this allergic reaction. Usually we are come up with in our life. It's a very some are non-itchy also. Usually we know that it is very much itchy, but there is something called non-itchy also. And some different because the deeper layer, if it happens, then known as the angioedema, sometime in the last few days. It's called dermographism. Out of 601, you may be having this. You can write your name on the forum. Totally you want to know that. This also is very one kind of very hypersensitive reaction. Okay, red clothes sometime also they may be having some itching reaction. Cold urticaria, see with the ice cube, you can get this kind of things. And sometimes pressure urticaria, sometimes heat urticaria also it happens the heat. So these all what you see. Yeah, angioedema, dangerous condition sometimes. Suddenly it happened that for some either could be some inhale or some touch or some food. All those things can happen. I can remember one when I was working in Padamular, Mangalore. One of my students, she came running that, okay, one of her cousin has gone for excursion, went to some hill area in Mumbai, school child she was, and she develops, because after eating some pakoda, okay, which is made of besan, and she developed some asthma. And she was asking what to do, because child is in the top of the hill. I said, only thing we can do is because he is in very proportion to risk. We should go for some antihistaminic drug, some anti-allergen drug. So it is better to give at least one evil which can save her life. And if she goes further, choking means she will die. So remember one thing, because you should not be stubborn always. We have some good medicine, you know that, but you cannot just get the medicine always in our hand. So I just saved her life, and she just somehow somebody went to the bike and just climbed there and get the medicine, just brought it down. Then we have given the medicine. So this angioedema sometimes can be very much some drug or some particular food item can cause life-threatening conditions and situation in our life. There are something not very dangerous like pityriasis alba, pityriasis rosacea. You can see that many people can come, especially in the early age group. They come with some white patches in the face. looks like what, some say it is deficiency, and we give good medicines are there, basilinum, tuberculinum, and sepia, natriamide. It works well. And we have sometimes, I usually prescribe for some condition like this kind of condition, that lime, the nimbu, that we can just rub it, and on the sunrise, sorry, in the sunlight for stay for 5-10 minutes. Sometimes it gives good result because it's a fungal kind of infection, so it might kill some fungus, whatever is locally available. So that is one thing we see. It usually aggravates during the sweating time. Sebaceous cyst, you can see the puncta is there, and it is very commonly seen in some areas like scalp, face, ears, groin region in the back. You can see this sebaceous cyst. Acne is very common in the teenage, and it's very embarrassing sometimes for the young people, especially the girls. So this is we can just we can get this acne vulgaris. Okay, it's very awkward looking. So sometimes some children, they go even for depression by this kind of skin very ugly looking. And we have ample of drugs, and if we can take a proper case taking, and we can treat them well. Skin cancer, another dangerous condition. Usually, those who work in the hot sun without much good sunscreen or sun protection, we may have, if you are exposed for a long time, the UV rays can cause a lot of skin hazard, and sometimes some carcinogen, if the people are getting exposed, that also can cause skin cancer. And acute, sometimes skin tanning and epidermal thickening and sunburn. You see some people, those who go to sun, the face become very dark. And after some time, it becomes normal, but this is skin tanning, usually called as sunburn also. You have seen that sometimes the cricketer, they put their sunscreen and when they go for fielding. So it is because of that. Chronic condition like a photocarcinogens and photoaging also is another condition you can see. Basal cell carcinoma of the skin is very common things. What you see some race, some particular Caucasian population we see more, and common sites are in the face and the trunk, which has been exposed in the sun. You can see this is the diagram of the skin feature. Squamous cell carcinoma also, which is also very common under skin condition. And usually the lymph nodes and liver also can go, but it can happen. So this is how we can see this carcinoma, this skin carcinoma. Melanoma, another condition, the third most common cancer, skin cancer. See 30% rise in the pre-existing mole. Okay, from there you can see this. Yeah, so this is most commonly arise in normal skin in the renal transplant kind of patient. Okay, to see that. But exact cause is not known, but it's seen that who has been kidney transplantation, for them we can see this more. Warts, very common thing, and we homeopaths are very much proud of this because homeopathy can cure this. I have seen dermatologist in Mangalore, he's a very renowned dermatologist. He has thuja in his clinic. Even not only the like a one bottle, I have seen bottle 1 pound bottle is there. Thuja he has kept, needs to give whoever comes for this. They don't give their medicine. They don't do cauterization. They just for them it is a cauterization is a treatment. But homeopathy medicine, they know it is very well work, and thuja is medicine for them. It's like a hallmark. But I have seen the person who has gone to him and has consumed maybe a liter of thuja mother tincture, but not got cured. They came to us, and I have treated them with Dalcamara causticum. So they are very good remedy in Dalcamara causticum where thuja doesn't work. Okay. So I just kept one. I think you all know. I think so. This is the plain word, the picture, the word. This is another plant of words. Then, and this corn. After that, another. These are corns are in the pressure area. We get this, or the more friction happen, and the food also you can see is very painful. Okay. And another is alopecia. It has been seen that alopecia can happen when it's for the male type, male pattern is androgenic alopecia called as male type baldness. It is very commonly seen for the male. And sometimes traction for the female, those who tie their hair very tightly, for them also, I can just show you one picture. Yeah, distraction alopecia. It is very actually so much tightly they tie their hair. So this can happen like this. This is areata, can be seen in the any gender or any reason. So now we just go to for the case taking, and some cases we just come across. The common skin condition, I just told you how it happened and what exactly the distribution of this. Most of the people will be having this age-wise actually see. There are some these conditions which is seen in the children age group, some are adolescents like acne, and some are in the middle age like some skin cancer condition, and the elderly age group is well as skin cancer as well as some wrinkle, rough skin. Psoriasis of course can happen in any age group, mostly the teenage and start, and after that middle age you can see this. And urticaria, there is no age, of course, again, but mostly it is seen in the early age group, in the teenage and adolescents, when they get exposed to the outside surrounding environment and some outside food when they start taking for that. So here we get some general thing like a question we should ask, and we should know where they reside. Sometimes a child come with this, some I just said, you know, a lot of small hand affected, some skin itching. Then you should ask them where they're from. Could be some overcrowding areas where the hygiene is not well maintained, not properly taken care. So the skin care. So those conditions could be the diagnosis can be happening that scabies. Occupation, a very important thing, because sometimes there maybe they handle some chemical, or they inhale something that also can be skin can cause some hazard. And dryness, then itching, eruption, all those things I told you before itself, and just you can. Some may come up with some fever. Fever is skin disease condition. Okay, chicken pox, and there are some scarlet fever, chicken pox, then measles, then you go for typhoid fever, dengue. Even though they are actually viral or bacterial some disease condition, but they come up at some day with some skin condition. Okay, skin, and you know that small, it could be macule, papule, then it become like pustules, or it may be like the biggest infection like what do you call this? Their as per their size, we usually talk to them sometimes. Okay, different kind of name we give them. So family history also required sometimes very much. And in one family, sometimes contagious. There is something contagious. Some condition like scabies, highly contagious. Then impetigo, highly contagious. Impetigo, contagious. That can be with the same towel if you use. You can have a molluscum contagious. By name itself, it can also happen like water droplet. Viral words that also can be happen in the same family. You can see this viral disease. So this is actually that's why you know that the family history somebody is having, the other also may get it. So this kind of you should ask sometimes their family background, where are they, and anybody is having or not. Site of the lesion, of course, where exactly they're located, you should know this. And macule, papule, vesicle, bulle, nodules, plates, we can just name them as per their size. Okay. Some are having thin skin, some are having very thick skin. Thin skin people, they usually get some abrasion, and usually very on and off they get the bruises and pustules, blood collection. It happens very common. Dry scaling, erythematous, thickened skin also very commonly seen that. Sometimes you see with many multiple or one solitary things are there that will sometimes give us some clues what kind of disease they are suffering from, and their distribution also. Okay, where they are distributed is important things. And this is actually I've kept some slides like what are the common medicine usually we come across in a practice. That doesn't mean that okay, papules, vesicle, crusting, all those things only graphite, sulfur, rastrax, not like that. Rastrax is vesicular eruption, we know that, and they have some modifying factors. Some are dry. Okay, graphite is the dry, scaly eruptions. Okay, ugly looking, fat, chilly, constipated people. They usually get the graphite skin eruption. Unhealthy look. Sulfur, you know. Like again, redness is there, as well as sulfur people are very much dirty. We say that, and they don't take much care. They don't go for birth. Okay, for that sulfur can come. Okay, rust cracks, acutely onset and very vesicle like eruption. Rust cracks we give and very good result we get. And therefore, this is sticky. Rust cracks is water droplet. Sulfur is burning and itching worse at night. Okay, that way. Arsenic will be having a different kind of modifying factor. Arsenic is very good for if the warmth amylation is arsenic. It's one of the special features. Whatever the disease condition is, if warmth amylation is there are some disease medicine like arsenic is very much. If after taking sea bath, I had a patient, he went for sea bath and after that skin disease happened. Nothing, close my eyes, I just give the medicine arsenic 1 and 1 dose, it cleared the case very fast. So these are modifying factors, very, very important things. You should know that. And oily skin, natramute, then thuja. Okay, warts ke liye thuja I told already, and there are some other medicine also, dalcamara, then causticum. According to their position or how they look, it is like a very tough. Then if it is pedunculated, we think thuja. If it is like a very rough and hard, we go for the causticum, dalcamara. In the palm, we can dalcamara. In the near the nail, we go for the causticum. So repertory में both many drugs are given that, so you can just very well read and you get the medicine like what do you call it, the indication. Scabies, I already told you, sulfur bath, sulfur soranum, very important medicine. Co20 also very commonly used. Antim crude is actually impetigo. Antim crude is very good for the corns, and that there's a the drugs. There are some more drugs that they are like hypericum, then ranunculus bulbosa, ranunculus can be called as, and heparsult, another important drug where the sensitivity is more, where the pus formation, pustules are there, you can think of. Okay. For vitiligo, art cell flavum, that is a drug. But I have seen that it may not do always the art cell flavum is a drug, but I have just come across many drugs like sepia, phosphorus, natramute, tuberculinum. Then I have come across even thyroidinum. Thyroidinum is a drug. Thyroidinum, you may not think that thyroidinum is very good well response, because as I said, vitiligo is autoimmune disease. So autoimmune disease actually should know that there's something imbalance is happening, and which is giving this some emotional turmoil that can just flare up the condition. So better we can think of some constitutional medicine, and of course some maybe deficiency something is there. For that we can think of some drugs. If I just go through now some of our medicine, some where I have treated some cases. I'll just tell you. Sorry, yeah. This is a case very recently just of psoriasis. You can see the extensive psoriasis condition. It's a full body was been every full except the face and scalp, hand, leg, thighs, everywhere it's full blood it is. And these cracks, you can see there is a crack oozing up some fluid, sometimes blood was there. And he was just advanced with this, he is a known case of hypertension and diabetes, and as well as he has this extensive psoriasis. You can see the condition, always 65, around 67 is group, the person. And I think it is patient came to 21st of October to me, and 21st October, and after the treatment of disease, first I gave graphitis, followed by went for arsenic 0/1. So this is 11/17. So October, November, you can see that almost 1 month is the result. Not even 1 month, I think just 1 month. Just 1 month is the result. Okay, it is done in our hospital, Jim's Hospital. I have asked the patient to get admitted because OP basis, because why is he's a diabetic, he's hypertensive, and his condition you see is almost oozing is there, and if it's a diabetic patient, sometimes there are highly chance for the secondary infection. So secondary infection can cause sometimes sepsis also. So I'm not taking a risk. I just asked the patient to get admitted here. He was there with me almost I think 1 week, 10 days. And after that, when I saw that patient was doing good, then I just okay, you can discharge you. Then slowly he is being just, and you see that the disease happened in the month of Hyderabad during the winter. It was the month of October, November, December. The patient was there with me, and that time that psoriasis it aggravates during the winter, and in that peak of winter, I could give him best result. And my PGs and other my UG students also have seen that. So this kind of they gain more confidence when I just admit them and show the result. So actually taken the case, and full case is taken, rheumatism is done, immediately medicine is given. So that is the beauty of the homeopathy, how it is. And very first I could give the result. It is just this is the month of February 2025, just to see that. This is the result of November, then December, Jan, it is a peak of winter, and I just asked him to come. I did not take all the picture. This is the best result you could see. This is the thing. Almost is now he is free of this. He had a rice mill. Now he is going for the rice mill and working there. Case of infected dermatitis. This is fully, actually this case has been aggravated with my medicine. I can tell you that. This is the first part, and this is the second part actually. Picture I just put it is. So this case actually got aggravated and I could not admit this patient. It is the case when I was in Padarmuller some years back. So a young girl, I could not admit her. They are not ready to get admitted, and I could not take care of her. So after giving the medicine, it was like graphitis case. I gave graphitis and aggravated. And after that, I could not, the case got dropped with me. Okay, I could not give her good result because that is actually the one kind of, see, it was a learning for me. It was a learning for me, and I just learned that that's why sometimes we need to admit the patient and do proper skin care. This patient is a slum area staying, and they went back. And after that, they could not maintain their proper, what do you call as, hygiene. So for that, they got secondary infection. And I could not manage it because they are not with me. They came, I think 12 days, 13 days, they came regularly. Dr. Saab, what I'll do? I said, see, you have to get admitted. No, not possible. Daily I have to work and daily wages. I have to work and I have to earn my bread and butter. So I just can't get admitted. So he gives some medicine. I could not control, I could not do it. But after that, I understand that actually it is required in homeopathy also. A lot of admissions are required when we need it. It's a learning for me. And after that, I make the patient to understand, I convince them and I do the result. Case of wart is actually, I will show this case, is a case, I think in Bangalore only. A young gentleman around 35, 40 years of age, he had come with this multiple, okay, see, I think one of my PG counted this, it was around 47 or something, he has counted that. And after that, it was after some days, it was decreased. You can see the size also, and some was fallen also. Okay. Yeah, I think it was decreased in size as well as some has gone. One more picture, I think I missed it. It was almost gone there. Okay, almost gone. So Tuja has helped actually multiple things are there, and Tuja has done the good result. Tuja 1M had given 2 doses that cleared the case. This is one case, non-healing ulcer. So mostly actually that varicose ulcer-like condition was there, as is the lower part, and it's a very ugly looking, and it was been almost rotten case you can think of. Okay, the dermatologist, allopathy doctor, they have given a lot of medicines, but could not do much result. And I have again admitted the patient and taken care. Almost month it took for me to give this result. Okay. This is cured. Almost new skin was coming up, but the only thing that because this is difficult for these to get the skin color here because that deep structure is involved, so I could not get the results. But there was no pain. He was ulcer free. Okay, he was ulcer free, and he could very well live his life. No problem as such. And this is actually, I'll tell you medicine what I've done that. Actually, I was, because when I remove this debris, okay, with the nicely the surgical distance, and daily dressing I used to do with my PGs, and with the ichnisia tincture I used to do because it was offensive sometime, and with that, and internal medicine was, calendula was given for some time, and after that only dry dressing was given that, ichnisia dry dressing, what I learned in my Calcutta training was there. Ichnisia dry dressing. Okay, we used to take ichnisia mother tincture, soak the gauze piece, and then squeeze it. And we used to keep the under the 500-watt bulb. On the table was there. We used to put on our what do you call this dots of the hand and just dry it for some few seconds. And after that, we used to put it on the this one. What do you call this? The ichnisia. If you give the raw ichnisia in the ulcer, that will make more pus. So dry dressing is required for echinacea. I have got very good result, and with that frequent dressing whenever required, alternate days also have done it. When that is slab and the offensiveness is gone, with that we have given the result. Yeah, this is actually all this ring worm literature. The plantar rabbits. This is in gyms. I have taken this patient. This is recent case, very recent case, where I have just this person cannot. She was feeling very awkward. She cannot. Even this is the sole I am saying that in the side also it was being cracked. She used to wear even summer also. She used to wear that socks always, and very much offensive foods are also to come. And again, this case also is being treated with graphitis, and one more dose petroleum was given last. Yeah, graphitis followed by petroleum, 200. With that, now this is the condition you see is almost almost healed. Just very few cracks there. It's like almost gone. So this is a miracle of homeopathy, how it does. It doesn't take much time. I think I had taken 3 weeks. 3 weeks it will. This was a young child. I had given tuberculinum for this child because tuberculinum for acne, you know very well, it acts. So it was given in the Allen's cut also. Tuberculinum is given there. Yeah, this is another new case. It is a challenging case for me. This is the bullous pemphigoid diagnosed case. All over body it has been there. Person has is a 79 years of age man, diabetic and hypertension both under medication, allopathy medication of course. I just kept 2 areas of photo. I have some more areas of full body, even genitally also. Even in the penis also there is eruption was there. Very ugly looking, and for me it was, my PG told that, sir, don't take this case because secondary infection is happened and patient might go for sometimes shock, we don't know. And his son is staying in Dublin, so he is now and then calling, sir, please do something. Patient is from Vizag, and all the way came to get the treatment from our college. So that was because of our college, there are some OP basis, they sometimes come. And so I said that during the Dasera, that's last Dasera, I said, you have to get admitted. He said, no, I cannot. I am improving with your medicine. I don't want to get admitted. And then the second visit also, I had given, I think, first visit arsenic. Then second visit, he did not want to get admitted. I said, no, you are getting infection, so you have to. I did blood examination where I could find out that 14,000 WBC count. Then I had doubt. Because his foot also fully like swollen something. I said, no, you have to get admitted. Admitted the patient, and after that, few days, see, this is the beginning when he came to me, full hand, and this is a polytel fossa in the leg, bursting and it's burning, pain, offensive discharge. I admitted him, and I have taken help from my allopathy counterpart, and he had given antibiotic course. I'm telling antibiotic course I have given him because he was going under infection. I don't want to take this. Here actually I have shown that integrative treatment, how we are doing in our hospital. Okay, in our hospital we are doing the integrative. We have allopathy, we have homeopathy, Ayurveda also we are having that. So here also, that is what genes we do it. So we have done it, and with this person, he was admitted, I think, for 5 days. I kept him in the hospital, and daily dressing, and with our medicine, here the medicine was arsenic was given. Sorry, by mancinella. First arsenic 1 dose, then for mancinella I went. So mancinella has given this result. So mancinella is a bullous disorder, actually one of the best remedy, and it has helped that. I have just proved this, and our PGs were very much overwhelmed because they have seen the result, how medicine talk, what is given in the book, and he got a chance to prove it. That's what happened to them. This is about little person. What you see, this is the condition, you see how it is. Lot of it looks like very ugly, and this is the condition in the beginning, and this is how you can see the arm, the axilla, and this is about little person. This is a very what do you call this? Got the very best result. Very fast got the result in this case. And one more case I'll just show you. Here the very acute case where I get this. This is one of my students' mother. So like herpes zoster like condition. Actually, it has happened. This is unilateral. So this is a herpes zoster like condition. Herpes zosters can happen. You know that those who get chickenpox, and after that it can happen. After some years, we can just come up with the dermatome, along the dermatome, very burning pain, and suddenly she got this swelling, And looking the swelling and that because he's a doctor's son, he was scared and so trainee, of course. He just called me, sir, this is the condition for reason, so what to do? I said, don't worry, no, sir, I am taking to the doctor. And they gave some steroids and we gave some painkiller, some fever medicine, a lot of 4-5 medicine they are given. What's that? So nothing doing, just stay calm. I just gave that. Actually, even though it looks like no herpes, as you said, the edematous swelling, but I have given, keeping in mind that it could be some irritant, something looks like that vesicular eruption. So that Rastux feature, I never forget that, and I have just given the Rastux 1 1 dose. Okay, after 48 hours is the result. Okay, this is nothing, no exaggeration. It has happened, and that he only just in the photo, it is gone. Open the eyes, everything happened, and within 48 hours, it's happened. Only the patients, but what medicine can do, homeopathic medicine can do, even in what you call acute condition, very acute condition, where there is a hypersensitivity reaction. If you know the cause, elements form, and of course, you have to use your brain. Use your brain, what kind of disease I'm handling, you should know that. Okay. Other day, one of my colleague called, they have shown me one picture. Sir, this is molluscum or it is this one? I have to see that. It is like a eruption, skin disease, you have to observe properly. Whether it is a chicken pox, varicella skin disease picture, or it is the molluscum. Molluscum is thick, whereas varicella is watered up. Like if you just touch it, it may break. It may break. So that kind of condition also. So all those things actually is to understand that. And for this pemphigus, this case, even my allopathy counterpart, this case, he told, sir, I'll take up. You give me. I said, no, I'll do it. You are there with me. He just gave only antibiotic for 3 days, then I stopped. He wanted to give steroid. I said, no, I'll not give it. With our medicine, he was wondering, sir, few days back, he had a similar case in his clinic. He has given one test for 45,000 and the patient was admitted somewhere, and with that, almost 1 lakh cost is given because it is dangerous disease sometimes. Pemphigoid, no, if it is goes for viral infection, very difficult to sometimes control it. So I'm telling that, so we could save life, we could save money, both we can do only our sweet pills. Now it is time for you. I can just question answer. If you have just, I have done my presentation, short presentation, I have done it. And if you have some doubt, can you please ask?
Excellent presentation, sir. Very much informative, schematic, and yes, it's a time of question answers. Persons can interact with the speaker. You can raise your hand. Sir, in these cases, which potencies you prefer?
Sir, actually, I have learned that mostly that the skin disease, better to go for 50 millisiemen. That gives, I can just share my one of my experience in my old college in Bangalore. One of my colleague there, allopathy colleague, he was a cardiologist. His mother he brought, she has sensitiveness of all the metals. Even her that sarika brooch, what do you call it, that pin, that also she used to use for golden. I just wonder. So what is this? Sir, because my mom is having allergy to this. So I just gave 1 dose of even graphite is 0/1, and you won't believe that was aggravated. So it's so sensitive. And I lost, means the drop from me. I think maybe more than 2 dozen the patient skin disease when I was young in Bangalore. So I just seen that they like homeopathy medicine for skin. They know that there's a good results there. But because of patient ka sensitivity, you don't know. Once you give 1 dose and if you just aggravate, they just leave you. They go to other doctor. Mostly the allopathy doctors, they go and they give their antibiotics and other things. With that, they just suppress the condition. That's what happened. So it is better to go for 50 millisiemen, and with that, if you are very much sure that, then 1 dose of high potency of 1 m. That some cases I have given that, and I got good result also. But if it is a chronic and if it is a repetition is happened, the recurrence is happened, better you go for this one 50 millisiemen potency.
That's great, because it's a very tricky situation. Usually when these skin complaints come, it's very challenging, and usually our fame will will be lost by treating a skin case itself, because it might be put the doctor in a disaster. Might be the case will be going smoothly. It will be dealt with a great precision. Everything will be fine. After this all suppressive treatment, persons will be coming to us, and when the right medicine is being selected, the whole scenario will come change, and this aggravation will make the person and the doctor get alarmed. So this 50 millisieverts is a great choice, isn't it?
Yes, yes, sure. Even now also, recently I have a patient, I'm treating that psoriasis. And she was suppressed for 19 years. Now she is telling the doctor, give me at least some relief. 19 years I'm suffering. I said, if I give medicine, again you might get some eruption. Then she is telling, then what should I do? I cannot come out. I cannot go out because his full face will also come. I said, you have to bear it. Then only I can start. She agreed. Now she came up with some mild aggravation. I have given 0/1 only with I think season or arsenic. 0/2 I have given that. And that was I have given only 6-7 days. Then I stopped. So now I think third visit she is I think tomorrow she might come. Yeah, everyone she comes. So I'm just waiting for her better result. But it is some eruption has come out. I told it will come out because you have suppressed it. I just cannot stop it. Slowly only you can. No, it's not come altogether. I said not come altogether. But if you are thinking so much, if you are sensitive again in your mind, it might come out together. So stay calm. Mental, emotional action is very important, sir. I have seen that. The moment we keep people confident level, then they are they will throw it very fast. If they have much fear, much anxiety, and then just throw very fast all the symptoms. It happens. It happens.
So, as a homeopath, while considering the skin, usually it's being taught to us that this skin is unimportant, and it should be considered all the person as a whole. And while taking a person as a whole and taking the simillimum, collecting all these symptoms together, and considering this whole together, when we are giving potencies, this skin will be challenged. I think it's very difficult as a for a classical homeopath. If we are going treating the pathology only, seeing the case, the skin only, we are using this type of medicines to alleviate the symptoms. Might be the symptoms of the skin will get alleviated, but the detrimental thing, because the internal organs will get affected. This is the core thing, well. What about that, doctor? As a fast consultant, as a practitioner, means it's a big scenario now. We need to first of all we need to alleviate the presenting symptoms which the person is suffering.
Exactly.
What should we do?
So that's why actually you should know that actually what kind of person is having the past history. In the past, what are the suffering they have already they have suffered. If we come to know, so we get some clue whether already some suppression happened, and for that only the person is already she's been experiencing some sorts of asthma or some other joint pain, kidney condition also. Usually they come. Sometimes they may get even epilepsy also, some convulsion. They don't know. It happened. It happened. So all those things just very cautiously you just should go out. But if it comes out, definitely they will be relieved all those things. As we know, our natural theory, what we can say that. So it is definitely we have to take the patient under confidence. Okay, even the family member, another most important thing, the family member, not the young child, young girl. So for them, no, as the parents, they should know that, because how the peer group also, they should also know it is like for the betterment of this internal something that they have to come out. So most of the time actually we need to make them understand actually how homeopathy works also. Those who are literate, and usually they understand that, because they know they have already gone many doctors, and they don't get the best results. So they usually stick on with us. And as a homeopathic physician, you need to be very cautious. Every step has to be taken. Every dose to prescribe for that dose, you need to always be careful that should we give or not, second dose or not, second dose should we give or not. One dose, wait and watch. Here it is required.
Excellent, doctor. And the speed which you have shown on that herpes zoster case, it was very fast. And Here is Dr. Ram Pravesh Shah with us. Doctor, please ask the question.
Thank you, Dr. Bindu Raj ji, and congratulations, Dr. Dhole sir.
Namaste, sir. Namaste. Thank you.
Heartfelt thanks. A special thanks, Dr. Dhole sir. Very nice presentation. Evidence-based skin diseases, ulcer, psoriasis, and verruca. Very good. Grateful presentation, excellent session. Sir, according to MIAD, में select remedy in skin disease.
Yes, sir.
And presentation during therapeutic dermatitis, Suja, etc. So very, very thanks, sir.
Thank you, sir. Thank you.
Thank you, sir.
I can just add one more thing. I have seen some children, they just walk in the sand, they will be playing, and they get sometimes skin disease. And that actually mother comes that they are very well to do family, but they leave their peer group, they are playing with them and see my son is.
Yeah, you can continue, sir.
Yeah, usually actually they will be having that iron deficiency. Okay, so I have got very good result with the calcarea curve silicea because iron absorption is less. And I have seen the doctor only giving calcarea curve few doses, no, and they just do the good result and this skin disease goes because the iron absorption is not proper. So calcarea curve silicea they do good. I have seen many children.
Do you have some particular food regimen which you follow for diseases?
Yes, sir. Usually for the psoriasis and other skin where there is a much eruption which is oozing, we don't allow them to eat like a shellfish or like a seafood mostly, and mostly the non-vegetarian things we should not allow them. Because that usually increases the less salt, another thing. Which can again increase the what do you call as that more protein synthesis, so that can cause sometimes more of the aggravation of the skin disease.
And what about the non-vegetarian diet?
That's why we ask them to a little bit restrict for few days, and unless until that the infective or what do you call oozing part is gone. So we just ask them to restrain for a few more days so that they get a good result.
Excellent. Great, sir. A lot of persons will be here to ask you questions, but I think we have some time limitation also, and it's an excellent presentation, very informative, thought-provoking, and the fast results which we gained for these autoimmune disorders along with this acute complaints is very much motivating. And on behalf of IFPH, I thank you for this session. And again, I like to remind you, just come back to our forum. We need more from you, from very much efficient persons like you. And thank you, sir. Thank you.
Thank you, sir. Thank you for giving me the opportunity in the platform. Thank you.
Thanks all for listening. And it's time to start the Malayalam session. Over to Dr. Shaila.